particular, they requested our executive director to prepare a report on the environmental impacts of antimicrobial and the causes for the development and spread of resistance in the environment. So it's just trying to answer or trying to highlight those questions that have been posed by the other speakers before me. This report is under development right now, and very soon the first draft will start to be circulated for comments and for inputs by the different experts around the world. One area as well that I would like to highlight is the issue of procurement and how procurement needs to be seen in a holistic manner. And that goes from the public procurement, but also to the patterns of consumption and production that we as choice, when we have the opportunity to choose, we might be able to make it different. But for that, we need to be aware of what's going on and to understand the implications of these things. And what we have been, maybe one of the main lessons from the report is that what we are doing at this moment, of course, is not enough, but it can help a lot if you are having very good waste management strategies, and if you respect the waste management hierarchy, then you will be able very quickly to understand the implications of these things. We are working not only at the international level, but also at the level of countries, and with India as well. We have a national office, and the national office is talking to the government officials and really working towards what was described by former speakers related to those standards and how to move things forward. The aspects of actions and plans, it's very critical as well. Investment needs to happen. But further to that, we also need to understand in a way that this is not something that one sector can solve as standalone. We really need to work together to address the issue. If you go to the next slide. Please, can you go to the, yeah. So this one I will not enter because there was a lot of discussion already. So if you go to the next one. Yes, so why I'm bringing this here, because at the end, when we see the environment, and this was also very well described by the former speaker, we always see the environment as the end point. But in reality, the environment is playing a big role that it needs to be tackled beforehand. And this is mainly what this slide was trying to say. Though there are pathways for antibiotics for human and veterinary use in the environment, sometimes we are not looking at the environment as such and how the wastewater is spreading or as the generation penalty, or what are the actions that we are not undertaking in the correct manner. So stewardship of antimicrobials will take thinking about more than just future patients or about food production standalone. It needs to be dealt in a way, in a more holistic manner. So with this, I think, and to conclude, we are doing actions at the global level with the report, actions at the national level, trying to really emphasize those aspects of the national action plans, procurement, monitoring, and we are working with the tripartite also in trying to better identify where the different organizations working on AMR can add value in a joint manner. So it's not because of a mandate here or there, but what are the real links that we can contribute and make things happen in a system-wise approach and in a system-wise manner. Thank you. That will end the presentation.
Thank you so much, Ms. Jacqueline, for your presentation. And I would also like to thank the efforts that are made in making the reports about this particular topic. Now we are going to move on to the mitigation strategies, and I will have an open question to everyone from the speakers. So what, in your opinion, are some of the mitigation strategies that can be conducted to tackle the environmental threats that AMR poses? So who would like to start?
I'll go first, Umar, if that's okay.
Yeah, of course.
Thank you very much. So I think it's a nice segue from the UNEP presentation. I think that one of the biggest progress in terms of environmental AMR has been the addition of the United Nations Environmental Program to the tripartite to make it a tripartite plus. We're really in need of global leadership in environmental AMR and its mitigation. I like the presentation, and it's great to see so many good initiatives that need to be now cascaded down to regional and national level. So we look forward to working with UNEP as a more visible and more prominent partner of the tripartite plus. Many of you would have also attended the Wellcome Trust report that was launched, that was done on Wednesday last week. It's entitled Global Response to AMR, Momentum, Success, and Critical Gaps. And one of the gaps that was identified related to AMR, or the environmental dimensions of AMR, where they said that we required a bit more research on three main aspects. So first of all, there's a lack of conclusive evidence of the impact of environmental AMR on human health. So as we showed in our study, we saw similar we saw similar bacterial species, strains, clones, antimicrobial resistance genes, and mobile genetic elements, but we didn't quite answer the so what. So yes, it's present in animals and occupational exposed workers and the farm environment and the water, but we couldn't quite show the transmission dynamics. How does it really move from the environment to cause disease in humans or to cause disease in animals? So this transmission dynamic needs to be addressed a little bit more. Then there's a question about where do we focus on environmental AMR? Do we focus on the places where there are very high concentrations? And Professor Larsen already spoke about that's the easy place to focus, because we have high concentrations. We can put into place mitigation strategies to drop the concentrations. But what about the very low concentrations? Those that are excreted in our excreta, in our urine from food animals and manure that is then used as agricultural material. And then this lack of awareness of the impact of pollution, anthropogenic activities, and climate change. So these were the three main aspects that required more research as part of the gaps that we identified in the Wellcome Trust aspect. Again, the bit about emissions and regulations, the publishing of the predicted no effect concentrations by the AMR Industry Alliance is a good step in this direction. Professor Larsen spoke about ozonation. Low and middle income countries would find that a bit of a challenge in terms of the cost benefit ratio. And we really need to do a little bit more work into what would be cost effective mitigation strategies in all income levels. And then the most important thing is for us to just ramp up and optimize our WASH infrastructure, the water, sanitation, and hygiene. And that would be the very first step in all countries across the world to look into the AMR, the environmental dimensions of AMR. Thank you.
Thank you so much, Professor Sabiha. It is really interesting to learn about the different mitigation strategies that can be taken from different levels. Thank you. Maybe Dr. Rajeshwari, would you like to also share some insight?
Yes, thank you, Omar. I think very insightful points coming in from Professor Ishaq, but one point which I would like to say from our policy advocacy experience is it is that AMR-centric management of waste is something which needs to be, it needs to start coming into consideration and start getting adopted at the global and national levels. You know, when we're talking about management of waste, we also look at it, what can be done, how can things be modified, or how can things be tuned so that I'm able to reduce the environmental impact or the environmental load of chemicals or drugs or any entity that can contribute to AMR eventually. While I understand that there is lack of evidence and a lot of more research is needed, but I think I would also like to say that let's not wait. Whatever we have, an idea of precautionary principle can work, and we can start taking action. And keeping this in mind, having the necessary policies and guidelines not just on setting standards, but also on how farm siting should be, how biosecurity can happen, how sanitation and hygiene and waste management can happen. All of this can be gradually taken into consideration, and we can start developing these for point sources, and also particularly for hotspots. My last point is the capacity of environment regulators and those involved in monitoring the environment. You know, historically, the training and experience has been with metals, heavy metals or pesticides. So antibiotics is something new. And also the microbiology aspect for an environmental regulator is also something that needs to be thought about. So a lot of training, capacity building, inputs on lab infrastructure needs to come into the picture. Yeah, thanks.
Thank you so much, Dr. Rajeshwari, for your insightful explanations. Maybe Professor Larsen, would you also like to share something?
Absolutely. I think I will repeat much of what Dr. Esak said before. I think that in the single most important measure across the globe is to work with WASH, basically with improved sanitation and hygiene, particularly as a measure to prevent transmission of resistant bacteria, and also actually to reduce use of antibiotics, because whatever kind of transmitted disease we get, we tend to take antibiotics if we look at it globally, right? So if you reduce even viral infections, you reduce antibiotic use, which means that you will reduce those factors that drive antibiotic resistance as well. So WASH initiatives are very often important. Then there are parts of the world where we have relatively little disease transmission via the environment, where we have more advanced waste infrastructure. And there's still a concern about what these lower levels of antibiotics that may not be degraded at all, some of them, in the treatment plants, what they're doing. I think that the uncertainty to what they're doing compared to the cost prevents, perhaps rightly so, many countries to take large steps to treat waste better. But what I think they should consider is the collateral benefit that would be involved in better treatment. With collateral benefit, I mean the benefit by which you get rid of many other kinds of chemicals at the same time if you improve your treatment. There's lots and lots of chemicals in our wastes that we don't know if they're problems today, but we will find out tomorrow. And if we can remove them today, that would be a lot would be won by that. Then lastly, I'd like to talk about the industrial pollution and more specifically what we can do there. I mentioned previously that we could work with how we buy medicines, how we procure medicines, and actually put demands on the producers to show that they have control over their emissions. So that's one very practical step that can be done by all countries. Regulation, as we have touched, that's something that can be done at least for those countries that have antibiotics manufacturing, but there's also a matter of fairness there. So there's an unwillingness maybe by some countries to put on regulations that are stronger than others, and to put on regulations that are worldwide. Well, that's difficult, we know that. So countries like India now, they need to be countries that go one step ahead of that. The last action I would like to bring up for combating industrial emissions, that is asking for transparency. Basically forcing companies to tell where their active ingredients are produced and also how much they discharge. Because as it is today, they don't have to tell where they produce their drugs, meaning that you and I, when we buy drugs, we have no idea where on earth these are produced. And these big companies that care a lot about their reputation, they can hide behind this secrecy. And then there is some company, maybe in India, maybe in China, maybe in Croatia or somewhere else, are producing these drugs in a really dirty place, and we buy it happily to a very low price. If we force them to show where these drugs are produced, the big companies that care about their names, they will start cleaning their own backyards. And that is a very cheap way of putting pressure. It actually could be changed by the act of a pen in the regulation at the EU level. So that's my very first wish to change the transparency with regards to the act that describes the approval of a drug, where it also says where they produce it.
Thank you, Professor Larsen. Definitely, mitigation starts from different points of views, from the individual level, from the global level, from national level, and from different aspects. Thank you so much for your good points. Last question is to Ms. Alvarez. What futures do we see for chemicals, and what implication this future has on AMR?
So we are at this moment at the international level discussing what we call the Beyond 2020 for chemicals and waste. That's a process that will establish and adopt a new framework in July 2020. That's, as I was referring in general for chemicals and waste aspects. It has a vision of healthy environment, healthy people in accordance with SDGs. And we are working right now in the strategic objectives, the targets and the indicators that framework needs to address. The different principles and approaches are being also discussed, starting from precaution and prevention. And I would like to really raise that aspect of prevention. For any chemicals management, it's better to avoid the chemicals going into the environment or into the humans before anything else. Of course, we also need to address legacies. And we, as it was mentioned as well, we have some very good practices and technologies around the world, but we also have those areas that are far behind. So any prevention measures for antimicrobial use, it's really important. And that can start in the healthcare systems, in the animal systems. If you ask me what to tell the young people that are watching us, or what the new generation needs to do to address this, first is to feel they are accountable, and also hold the governments accountable for certain things. But having said that, this is a chain, there is a supply chain behind. So countries need to really, in their action plans, look forward how to address the topic. Of course, regulation is essential, and that's also what in general in chemicals are the basic approaches. Pharmaceuticals are chemicals, antimicrobials are pharmaceuticals. So at the end of the day, the question of regulation is essential. But we also need to consider access and the right of a healthy life for people and well-being as well. So there are some issues where sometimes they are being seen as trade-offs, but are a question of priority, as it was said before. But at the end of the day, it's not only that. We really need to be very picky on those trade-offs, because it might have medium-term and long-term implications that we are not looking at this moment. One other area is that we know a lot of things right now, but we also don't understand the so what that was mentioned by Sabiha before. And what does that imply? That also anything that we are doing on AMR and environment, and it's published in scientific journals, to share, to really try to include also the press and journalists in understanding the different situations, because some of the things really need the media to be helping us, but it needs to be the educated media as well. There is a big role of those working or prescribing medicines, from the vets to the doctors. It needs to really be done in a conscious manner, without being afraid sometimes of being, having judges afterwards following them because they didn't do this or they didn't do that. There needs to be systems to protect. Further to that, don't flush medicines into the toilets. Try to take back programs for unused and expired pharmaceuticals areas. All those concepts are being right now discussed in the context of this Beyond 2020, but also in the tripartite arena. And now I'm happy to say we are being called the quartet So it's no longer the tripartite plus, but the quartet. We are really trying to work on how to scale up the AMR issue. We completely agree. There are actions that can have the collateral benefit, but there are actions that needs to be very specific to deal with AMR, and we cannot forget those. So, and they are not mutually exclusive. They need to work together as a whole. And we live in a system, environment is a system, and we need to address things in that manner, not in an isolated or siloed way. So that's in a nutshell the different things that we are doing at the international level, at the regional, but mainly promoting the things and the understanding. If people don't understand the implications, it's harder. So thank you.
Thank you so much, Ms. Jacqueline, for your insights. Of course, education can play a very important role for the futures we're looking towards antimicrobials. As a final question, I would like to ask our speakers. We have some experts, so we're very lucky to have you here with us. We have thousands of young people watching us. So can you tell them one action they should take in order to solve the AMR threat? Who would like to start?
So shall I go first again, Umar? Thank you. So my one piece of advice or request would be reduce your antimicrobial footprint. If each one of us takes this personal responsibility seriously, we will have dramatically reduced, if not removed, one of the main drivers of AMR. So let's reduce our antimicrobial footprints. Thank you.
Can I go second?
Thank you. Yeah, of course.
Yeah. Okay. So my small message would be that, action begins at home. So although it's going to be difficult and a lot of behavior change involved, but I think we should restrain ourselves from disposing unused or those medicines which have lost their use or have expired along with regular municipal waste. We should try and not do that because it has implications going forward, like we've heard today.
Thank you, Doctor. Maybe Professor Larsson.
Yes, I will suggest a small thing that will have an effect on a small part of this bigger problem. And I'd like everyone to, when they go to the pharmacy, when they talk to the doctors, they should ask the question, is this drug produced in an environmentally controlled way? Who has produced it? Where is it produced? If these questions are start to getting asked around the world, then people are getting more aware of the problem, and eventually maybe we'll get there where we start to get some control over the industrial emissions. So start to ask for transparency.
Thank you so much, Larsson, for your very important advice. Maybe last advice from Ms. Jacqueline from United Nations Environment Program.
Yes, and my advice goes in very similar lines to Dr. Larsson's one, but mine is not to ask for transparency, but not to ask for things that the doctor does not believe. I'm coming from a developing country, and many times we push the doctor to give us a prescription. And if the doctor doesn't do it, we go to the pharmacist and we push the pharmacist to give us the antibiotic, believing that we know more than they do. So the actions begins at home, but also actions begins when we are buying some things and when we are putting the pressure on others, that because they want to sell, they sometimes don't say no. They just go and find the prescription for you and give you the medicine that was not prescribed for you. So that's my message to all of you at this moment.
Thank you so much, Ms. Jacqueline. I think we did it on time. It's 2 p.m. GMT. Thank you so much for listening to us and for the speakers who shared important insights to different youth from various disciplines around the world. Thank you again. And for the people watching us, don't forget to share your thoughts about this session on Twitter, on the chat section, everywhere on social media, and don't forget to tag different organizations. Now I give the floor to Mutiat, and we move to the session called Rational Use of Antimicrobials for Animals. Thank you again.
Thank you very much.
Thank you.
Thank you very much, Omar, and all the others. It was a pleasure to talk to you.
Thank you. Same for us.
Thank you.
Thank you.
So I hope everyone enjoyed the previous session, Saad here from the organizers. And now, as we are welcoming the panelists and making sure we have all the panelists today, again, another high-level panel we have today, and also our colleague Mutiat from IVSA will be the moderator. So just as we activate all the cameras and take care of the logistics, 1 minute and Mutiat has the floor to start the session. We're just facing some small technical difficulty, but we will be starting soon. So we have with us our full panelists, I guess, present. We have Dr. George from OIE here, Charlotte present, Dr. Amanda as well, and also we have Dr. Russell from BVEMT. So I guess the panel is complete, and also Mutiat is here as well from the organizing team. So yeah, to you the floor.
Yeah, sorry for the delay. It was some logistics. So I am Mutiat Adetona, chairperson, the International Veterinary Students Association Standing Committee on One Health. I will be moderating the session, Rational Use of Antimicrobials in Animals. So yesterday we learned a lot in the introductory session. We learned about the rational use of antimicrobials in humans. We learned about the future we're looking towards with the use of antimicrobials. We also talked about education and stewardship in the use of antimicrobials to our healthcare professionals. And just now we've learned about antimicrobials and the environment. So today we're having with us here our speakers. We have Dr. Jog Pinto Ferreira from the OIE. He is the deputy head of the antimicrobial resistance and veterinary products departments at the World Organization for Animal Health, OIE. He's also a doctor of veterinary medicine, master's in food safety, and PhD in population medicine. And we're very delighted to have him here with us, Dr. Jog Pinto Ferreira.
Thank you, my pleasure. And how do we proceed? Do you want me to do the presentation now, or you present all the speakers and then we do the presentation?
Yeah, Yes, yes, sir. We'll present all the speakers and then.
Okay,
we'll proceed.
thank you. Thank you for the introduction. Pleasure to be here.
Thank you. Then we also have Dr. Charlotte Rendina. Dr. Charlotte Rendina was also a member of the International Veterinary Students Association. She was she worked as secretariat, where she also drove the fight against AMR by being a part of the executive board meeting of the World Health Organization and World Health Assembly. She's an intern at the European Commission for the Control of Foot and Mouth Disease, and also at the FAO, that's the Food and Agriculture Organization and the United Nations. She's also having a master's in One Health at the University of Edinburgh. Thank you for being here with us, Dr. Charlotte Rendina.
Thank you all. It's a pleasure to be here.
Then we have Dr. Amanda Boudin. Dr. Amanda Boudin is the One Health Director for antibiotic stewardship at the University of Minnesota. She's also an adjunct assistant professor at the Department of Veterinary Medicine at the College of Veterinary Medicine, University of Minnesota. We're very pleased to have you here with us, Dr. Amanda.
Thank you so much. I'm so glad to be here.
Thank you. Last but not least, we have Dr. James Russell. Dr. James Russell is the president for the British Veterinary Association, the 2020-2021 session. He's also a farm veterinarian, and we're very pleased to have all of our speakers here with us today. Dr. James Russell.
Delighted to be here. Thank you for that welcome.
Thank you. So to start the session, we would have a presentation from Dr. Job Pinto Ferreira. He will be giving us an insight of his work at the OIE, and also more of the connections that the OIE have with the global and international organization in the fight against AMR. So I'll be giving the floor to Dr. Job Ferreira now.
Thank you very much. So let me just share my screen. You can see it?
Yeah.
Great.
Yes.
Thank you, and thank you for the introductions. Thank you for the invitation, and congratulations on the organization. It's a pleasure to see about 1,000 participants interested worldwide, students, young colleagues interested in this topic on during the weekend. So it's great to see your interest. So as you said, I will present some of the work that we do at the World Organization for Animal Health, and I'm the deputy head of the Antimicrobial Resistance and Veterinary Products Department. For those of you less familiar, the World Organization for Animal Health is known as OIE because it was the original name in French, the Office of International des Epizooties. So we are based, the headquarters is in Paris, in France. So we are about 150 people at the headquarters. And then we have offices and regional colleagues across the world with reference laboratories and so on. Altogether about 180 members or member countries. And our mandate is to improve animal health, welfare, and veterinary public health. And we do set standards recognized by the World Trade Organization. And it's a long story, and I think we'll have a lot of time to discussion, but AMR is becoming, or in principle will become, a trade issue. And that's why this trade word is of concern at the moment and for future reference. So just a quick, in a nutshell, this is our department. At headquarters, we're about 12 people working on the topic. And this is actually a recent department, interesting enough. There's reference to the OIE work on AMR for a long time, but the topic became so relevant and the commitment of the organization to AMR became so relevant that about 2 years ago, the AMR work was developed into a whole department. So that's where we are, 12 people from across the world, different backgrounds, different colleagues working in the different work streams. So you have there the names of us. Very briefly, the OIE developed a strategy on AMR and the prudent use, responsible and prudent use of antimicrobials. And these are the 4 pillars: improving awareness and understanding. And for example, your action today fits into this pillar of the strategy, improving awareness and understanding. then strengthening knowledge through surveillance and research, and I'll very briefly mention our data collection on antimicrobial use, then the support of good governance and capacity building, and finally the implementation of our international standards. The standards that I referred to are the what we have in our codes and for terrestrial and aquatic animals. So these are public, and you can easily find them on our website. And so these are the recommendations, let's call it this way, that we give to countries regarding the several different aspects related to AMR. And there's this obvious distinction between terrestrial animals and aquatic animals. And for now, we work mostly on food production animals, although the scope is getting bigger, and we started working also a little bit in companion animals. But for now, most of our work is related with food production animals. This is a graphic just to mention the work that we are doing on antimicrobial use data collection. So we have 3 colleagues at the headquarters working full-time on this data collection, and we published this year the 4th report. And before joining the OIE, I joined about 3 years ago. I honestly was naive enough to think that I wasn't aware of how much work and how complex this is to collect antimicrobial use data at the global level of the different animal species. So it's a really impressive amount of work that these 3 colleagues do. They publish now the 4th report this year, and early next year, in 2021, the 5th report will be published. And the graph below is just to emphasize that we are quite proud, to be honest, that we have been an increasing number of countries reporting their data to us in terms of antimicrobial use, and then we can, in the discussion, further explore this idea. Regarding responsible and prudent use, I said we have the standards and guidelines. So the standards is what we have in the codes for terrestrial and aquatic animals. And the guidelines fits, for example, on this, what we have in our OI list of antimicrobials. As by now you are probably more than familiar with the concept that most or a vast majority of the antimicrobials are used in plants, humans, and animals. And so there's several different lists ranking the importance of the different classes. And in our list, we have a specific section on recommendations for specific classes. So that's a unique thing of our own list. So I put there the link. You can further explore or we can discuss during the panel. A quick mention on this tripartite publication that was published actually yesterday, since we are in the World Antimicrobials Awareness Week. This is a compilation of all the legal instruments across the 3 sectors. So it's at the global level, not so much at the regional or the national level, but at the global level. So it's like if you want to know what global laws regulate the use of antimicrobials in the 3 different sectors, this is the place to go. So it was published yesterday, and we are quite happy, and I think it will be a very useful publication. But it's just in a very small example of the daily work that we have with the other global organizations. And the final note here on the communication work. Our communications department developed this "We Need You" campaign. We have there the link, and there's a specific section for students. So and you can download videos and flyers and whatever. So and the message is very true. So we need you students, you practitioners, you farmers, you customers, etc. But it's a very successful campaign, and I recommend you to have a look at the link and explore the materials. So I'll leave it here just for the introduction, and I'm looking forward for the other presentations and for the discussion. Thank you.
Thank you very much, Dr. Pinto. That was very interesting to watch. We like to see the work that is going on at OIE against the fight, in the fight against antimicrobial resistance. I agree that we need to improve the awareness and understanding of the antimicrobial resistance at all levels, so that people can be more aware of this resistance and also try to start to take responsibility in the use of antimicrobials. I'll be moving on to the next speaker, Dr. Charlotte Rendina. She'll be giving us an insight on how youths can be involved in this fight against antimicrobial resistance. We'll be talking about how to create more strong interdisciplinary collaboration and bonds in between students, and also the topic as well. Yeah, Dr. Charlotte Rendina.
Hello, I'll start sharing my screen. There. Can you see it?
Yes, I can.
Perfect. Perfect. Right. Thank you again for the invitation. It's a pleasure to be here with all of you, and thank you for bringing together all these professionals from all over the world to discuss AMR and a One Health approach. Today, I'm going to talk about the journey from being a student to being a new graduate, and through my own journey. And I'm going to also, which is something that can be applied to many other students, not just from the veterinary world. So first of all, I'm going to explain how I became involved as a student in the fight against AMR, and then my experience as a new graduate working in small animal practice, and then some messages for the future for people who are interested in AMR and what we should all be doing. So as a student, I first became aware of AMR through my core training at university, the lectures that were provided and the outline that was given to AMR in general. So it was explained to us what it was and the concepts of it. However, I had a more active role in AMR when I joined the International Veterinary Students Association and was able to take part in events, workshops, awareness campaigns, and attend meetings such as the World Health Assembly, where I was able to see firsthand the work done on a global level by the WHO, the OIE, the FAO, and many other organizations alongside them. However, the most important part of this was the student networks that I was able to create and be part of. So I was able to discuss AMR with students from the medical profession, the pharmaceutical profession, dentistry profession, and together learn about AMR and what it means to different professionals and what it means in different countries around the world. And this gave me a huge insight and a better understanding of AMR in general. And so that's what I really want to underline, the value of these networks, and especially when they're interdisciplinary, and the importance of having open discussions with other students and to use this knowledge that we can gain to also critically analyze our own approach and our own protocols through examples from different countries and different professions. Then other ways in which students can become involved is through research projects. In my last year, I did a research project on the antimicrobial effects of manuka honey and propolis against Staphylococcus pseudointermedius, which is often causes of pyoderma in dogs and often resistant to many antibiotics. And this gave me a very good insight into AMR and enabled me to see AMR for a different way. So see it firsthand, see it happening on the Petri dish in front of me. And I was able also to be at the forefront of exploring new ways to deal with infections, which are not necessarily through antibiotics. And then I was also able to use this knowledge in clinical medicine when I started working. As a new graduate, there are, of course, always challenges that we will face. And these also include challenges around AMR. So some of these include the demand from clients. Often clients will demand antibiotics, and this can lead to sometimes challenging discussions around treatment plans. Inexperience has a huge role to play. So inexperience can an antibiotic is necessary or not, which antibiotic to give, for how long, the dose, and it can in some cases lead to anxiety and worry of making a mistake, which can lead some people to prescribe broad spectrum antibiotics when in doubt. Then there's also the issue around the overuse of antibiotics. So as a new graduate, you might have a lot of protocols in mind, a lot of ideas on how to deal with AMR, but then you find yourself maybe working with some colleagues who tend to prescribe antibiotics for routine surgery, for example, or to prescribe them freely. And this can lead to conflict, not just with your colleagues, but also with clients who might, for example, bring their animal for a urinary tract infection and expect to receive an antibiotic straight away. And then it might lead to difficulties when you ask them to bring a urine sample to test before giving an antibiotic, for example. And this is also linked with financial and time constraints, which can make this even harder. But there are tools and there is support available for not just new graduates, but people in practice in general. So one useful tool is job aids. These can be in the forms of apps, forms of notes, posters, and they can provide a very good guideline and a very good framework in deciding which antibiotic to give and when, in deciding the dose and the duration of treatment. And if they are in the form of an app, they can be even more valuable in the sense that data which is registered can also be used to feed into central databases and used for surveillance in AMR, as there is quite a lack of data with regards to surveillance, especially in veterinary medicine. So this can be very useful. Then it's important to understand how to bring others on board. So when joining a new practice, it can be challenging and you don't want to join and become in conflict with all your colleagues or with clients. So it is first important to understand how to work alongside others. So both your colleagues and both your clients, and to try and achieve a better use of antibiotics through collaboration and support and discussions. And then it's important to have a good support network. This is in the form of friends, of family, of colleagues, students, so that you have someone to turn to for advice, someone to turn to for discussion, and always have, you know, the available support there ready for you. So finally, there's some key things that I think we should remember as students and young professionals, and that is to keep the bigger picture in mind. So always remember that we are prescribing an antibiotic to the patient in front of us, but this has wider and more important implications. It is connected to environmental health, it is connected to health, and not just veterinary health. So we must always have this at the forefront of our mind whenever we're prescribing an antibiotic to any animal or any patient, that it is all connected and it is part of a wider, bigger picture. Then we must also remember to update our knowledge and to make sure that we are always informed with regards to the most recent guidelines, the most recent protocols to follow, but also the other treatments which are available for infections which are not necessarily antibiotics. And then remember that from clinical practice to global advocacy, we all have a very important role to play, and we are all equally responsible to make sure that antibiotics are used properly and that they're used with the care that they deserve. Thank you very much.
Thank you very much, Dr. Charlotte. That was very enlightening. I do agree that lectures and outlines in the university also have a very good contribution to the knowledge of the students on antimicrobial resistance. So this is something that schools should take into consideration and also get the students more aware of antimicrobial resistance. Also, the challenges you mentioned, they're very valid, from demand from clients, the financial constraint. These are also things that could contribute to antimicrobial resistance, because maybe the clients would not take in line to the instruction from the doctor or the prescriptions and stuff like that. Also, your final notes, to always remember that prescription is, when prescribing, that this is a part of a bigger picture. So we always have that in mind. Also, we should always be informed, well informed. We should keep updated with the most recent updates in health and how to use the antimicrobials, and also that we are all involved. This is also part of what Dr. George pointed out, that we are all involved. We need you. Everybody is involved in the fight against antimicrobial resistance. Thank you very much, Dr. Charlotte. We would now have Dr. Amanda. She'll be taking us on antimicrobial resistance in companion animals. She'll be talking more on dogs and cats. Dr. Amanda.
Yes, thank you so much. And let me share my screen. Do you see this okay?
Yes, thank you.
Great. So thank you again for having me. I thought today I would focus on companion animal prescribing and antibiotic use, because often we sort of overlook it with a lot of emphasis on animal agriculture. But here in Minnesota, we have really tried to take a One Health approach that includes not just agriculture, but also small animal medicine as well. So we'll get started here. The first thing I just wanted to talk about is why do we really care about pets and antimicrobial resistance? And I realized that across the world, we have different relationships with our pets and with domestic animals that live in our domestic spaces. But one thing that's for sure is that we are often in close, direct contact with these animals, and we care about whether they have infections that can't be treated. So why do we care? We care because we want to make sure that we're able to treat them when they are sick. We also care because we know that maybe in veterinary medicine, we aren't as good at targeting our antibiotics to exactly what the condition is that the animal has. And Dr. Charlotte mentioned some of those burdens when we're trying to balance cost and trying to think about what's the best thing to do and what's normally done in a clinic with what we know are the recommended guidelines. And so it's not, but that said, they do receive medically important antimicrobials, including cephalosporins and fluoroquinolones, and it's expected that, at least here in the United States, unnecessary or inappropriate prescribing for dogs and cats and horses is probably about the same as it is in humans. So, you know, maybe 30% of all prescriptions are unnecessary or inappropriate. We also have concerns about the potential spread of resistance. We're in close proximity with these animals every day. There are some studies that show that people who live in a household with dogs, they actually share more bacteria. So if you have 2 people who live in a house with a dog versus 2 people who live in a house without a dog, the people who are living with the dog, their microbiomes are more similar to each other because they have that dog as the shared source of bacteria. He's sort of a fomite that can move back and forth. In addition to sharing more of their microbiomes are more diverse. So we do share a lot of bacteria with these animals. The American Veterinary Medical Association has identified some core principles of antimicrobial stewardship, and these are relevant for all of veterinary medicine in the United States, but I do mention them here in particular as we talk about companion animals, because there are things that our veterinarians that are out there practicing every day really need to think about. So the first is to commit to stewardship. Realize that we might not be prescribing perfectly, and there are things that we can do to improve and optimize prescribing. The second is to advocate for disease prevention. If we prevent diseases in the first place, then we're really going to not have to worry about whether to prescribe or worry about whether the infections are resistant. We, of course, need to think more about how we choose antimicrobial drugs and for what indications. And then we have to evaluate how we're using those drugs once we choose to use them. What is the dose and the duration that we're using? And then we have to educate and build expertise. And this is really one thing that we focus on here in Minnesota, is getting people that prescribe in all different sectors together to talk, and linking pharmacists, for example, with veterinarians, and pharmacists with even general practitioners in the human field as well. So where can we improve when we think about prescribing for our small animals, as we refer to them, dogs and cats? We can realize that there are some available guidelines for prescribing. The International Society for Companion Animal Infectious Disease does have some prescribing guidelines that are available, but we know that we're not doing a great job, at least here in the US. There are some studies that show that only 80% of those dogs that are seen for upper respiratory tract infection get a guideline concordant antibiotic. And when we talk about specifically canine bronchitis, we are only giving them the antibiotic, we're only practicing in accordance with the guidelines 22% of the time. And one of the things just to notice, because this is, as you all know, this is why we're here, a One Health issue. It's important to note that these prescribing challenges are really the same that we have in healthcare. Avoidance of antibiotics for acute bronchitis in humans is a real target for stewardship. So a lot of the same issues. We also know that we need new prescribing guidance. The prescribing guidance we have doesn't cover all of the things we need. For example, antibiotics are commonly used for gastrointestinal disease, even when there isn't really evidence of infection. So we could really use some guidance to help us better deal with those animals that come in with acute diarrhea, for example. We could use more cytology and culture and susceptibility testing, making sure that we have evidence of infection before we're prescribing, helps us to guide what our drug choice is, and also then allows us to make changes once we've already prescribed. Another spot where we could improve in small animal medicine is by figuring out what's the appropriate duration. In healthcare, they've really targeted for this drug, for this uncomplicated urinary tract infection, we can have a real short treatment. And for animals, we think that we can shorten our duration, but we don't really have the studies that say that that's really possible. And then tracking antibiotic use. I was really glad to hear the information from OIE about the global tracking. And this is something that we need to do in individual clinics nationally and globally, because we can't make change without knowing what we're doing. Just want to highlight a couple things that might be new to you. We here in Minnesota, it's a collaboration between the Minnesota where I work and the University of Minnesota where I'm adjunct. We have worked to develop this handbook of antimicrobial stewardship in companion animal settings. And it provides outline for how clinics that have maybe basic capacity, moderate capacity, and advanced capacity, everyone can implement stewardship changes in small animal. And that's based on the AVMA core principles. The other thing that I want to bring to your attention is that I mentioned the International Society for Companion Animal Infectious Diseases has prescribing guidelines. We have taken those and put them into a single pocket card. If you print it out, it will fit into the pocket of your white coat. It also can be hung up on a wall in the clinic. And it really just has these common conditions for which we prescribe antibiotics and the recommended drug and duration and dose. And then just lastly, to wrap it up, what can you do? What can we all do? When we're having these conversations, just like at this summit, we really need to involve veterinarians and animal health professionals of all types. We often have folks from agriculture, but we need people to be talking about small animal too. We need to connect veterinarians with other experts outside of veterinary medicine, like pharmacists and physicians, to talk about their experiences. That's what we try to do here in Minnesota. We have had pharmacists and physicians tracking antibiotic use for years. And so we're pulling in those experts to help us think about solutions for small animal medicine. We need to communicate the threat of antimicrobial resistance with our pet owners. Antibiotics are not always the answer, and preventive care is really important. We also need to remind people not to put antibiotics that are left over in the toilet or in the sink. That's an important message, whether we're in the pediatric clinic or in the small animal clinic or on the farm. And then we also just need to reiterate all the time that we need a One Health approach for this. Everyone who uses antibiotics contributes to the problem and can contribute to the solution. So just on the last slide here, to leave you with some pictures from what we do here in Minnesota. We bring people together from all different fields, public health, researchers, human and animal health professionals, and pharmaceutical companies. And we go to different places, see how it works on the farm, see how it works in the acute care hospital, see how it works in the outpatient setting. And in our one photo here is from an animal shelter. So that's what we'd like to share. There's resources on our website for you to find. So thanks so much for having me.
Thank you, Dr. Amanda. It is very amazing to see the work going on at Minnesota in the fight against antimicrobial resistance. So I'll just highlight a few things from your presentation. The stewardship, disease prevention, select and use judicially the antimicrobials, also education and build your expertise. I think these are very important points that you've made during your presentation. I'd also like to say that I agree that more work to be done in enforcing the proper use of antimicrobials. We all need to be involved. the One Health approach is very important in the fight against antimicrobial resistance, because we need all sectors, from human health, veterinary medicine, agriculture, pharmacy. We need everyone to be involved in the fight against antimicrobial resistance. It's also important that we also need more awareness on the antimicrobial resistance in small animals, because more focus is usually channeled to the food animals and the bigger animals. So thank you very much, Dr. Amanda. Thank you very much for your presentation and for being here with us. So Dr. Russell will be taking the floor now. Thank you very much.
Good afternoon, and thank you. And sorry for inadvertently starting to share my screen too early, but thank you for welcoming me here this afternoon. And I've been absolutely thoroughly absorbed by those previous presentations, and hope I can add something to them from our position here in the UK, and thinking about where we're at with the whole kind of One Health concept and antimicrobial stewardship, and where I see BVA leading on that in the future. So I'm currently the BVA president, and that's a very privileged position to sit in. It means that I get to spend an awful lot of time focusing on this. But in my day job, I was a farm animal vet for 17, 18 years, and came out of practice to really focus on my area of interest, which was infectious disease, and particularly TB. So that's not too relevant to antimicrobial usage in the UK, but infectious disease more broadly. An update on where we're at here in the UK. So, this report was released January 2019 by UK government, and was looking at antibiotic usage through to 2017. And we're going to have a quick look at some of the animal-human comparisons and see where we can work more closely together as we continue forward with that. And we followed it with our own report, the One Health in Action report, which was BVA led, but supported by medics and pharmacists and dentists and a variety of other disciplines within the UK, to release that last autumn. And there's a number of chapters in it, but they all kind of focus on this One Health principle of joining together animal health, human health, and environmental health. And if I can delve into just one of them, and my goodness, we didn't have a crystal ball, I promise you, when we wrote this one, but thinking about zoonoses and the impact that that might have on the human population, we've all lived through that, haven't we, in 2020, and recognised exactly what impact that can have on human health and human medicine as well, and the importance really of maintaining the vigilance that we have to acknowledge that up to 60% of new and emerging human diseases come from animals, and therefore I think vets do bring an awful lot to this party, and we've got a lot to give in this global discussion. So in terms of where we are and where we've come from in the UK, I think that the headline here, look, is that tonnage of antimicrobial usage in that period dropped, whether you looked at humans, whether you looked at food-producing animals. The slight blip there is in companion animals, and we're going to come on to what we're doing with those further on in the presentation. But the good news story, as far as I'm concerned, as a vet, is we're leading the way in the farm animal sector here. We're brilliant, 40% reductions in overall tonnage of antibiotics being used, compared to a 9% drop in the human population. And I'm not saying that to kind of poke fun or to deride what's going on in the human medicine field. I think there's different challenges, and I think during this period in particular, we as a profession and working alongside the farming industry have recognized where we have used perhaps prophylactic and metaphylactic drugs in a way which is no longer justifiable and is inappropriate based on current evidence. And that gave us some of that low-hanging fruit, I think, to really make some initial inroads into the reductions that we've seen. But for me, the really good news is the reduction in high priority, critically important antimicrobials that we've been using in the farm animal sector. And we'll see on the next slide just what a tiny fraction it is of everything that's administered. And okay, so over the same time period, that's gone up slightly in human medicine, but actually, I'm not going to make any comment on that. I'm not a doctor, and as I see it as a vet, our priority here is to preserve those HPCIAs exactly for human medicine. So I think that's fair enough. But I think what I would want to point to, and somewhere that as a profession and as a, say working with industry, I think we do really lead the way, is in biosecurity. And it's interesting when I talk about this with human health colleagues, they use different terminology, but ultimately we're talking about biosecurity. And look, this has been, just normal practice for years for us, hasn't it? So here we are, I've been having a chat with a cow. I'll then go and wash my wellies in a suitable disinfectant that's going to kill whatever bugs may or may not have been on that farm and around that cow. And I do that before I see another group of cows. And, by taking those risk reduction measures, we've been able to, enable traveling around the country, we've been able to move animals and people and so on and so forth in a way which has still reduced disease risk. And I would compare that to, to what we've seen, certainly in the UK through COVID, which has been this very powerful message that, there's just nothing that you can do early on in this pandemic. There's nothing you can do. You just got to stay at home and stay away from people. That's the only way that we're going to reduce the spread of COVID. And of course, we've recognized that, for all sorts of reasons, be they economic reasons, but also for social well-being reasons, that we just can't continue in that way. And so have evolved to this hands, face, space messaging. And I think, what I take from that really is very similar to a lot of conversations that we have on farm when we talk about antibiotic stewardship and trying to prevent diseases getting onto farms, which is about risk reduction, not risk elimination, and saying that actually, we've got to find a way of reducing risk in a way which allows us to sustain the activities that we all need to engage in. And I focus on that a little bit here to just say, look, we're not trying to generate absolute, germ-free biome around our livestock. We recognise that that's an unachievable goal, and therefore we recognise that antibiotics are always going to play some part in our production systems, and that's quite right. But to just bring us a little bit more up to date with where we're at in the UK, the VARS report, the Veterinary Antimicrobial Resistance and Sales Survey data, has just been released this week. Going up to the end of 2019. So this is the 2020 report. And just to pull a couple of very quick headlines out of it, look, I'm really pleased that for the third consecutive year, we've held this level of antimicrobials down at around about 30 milligrams per kilogram. And that represents, compared to 2015, this 45% reduction. But actually, if we go back to 2014, it's an even greater percentage reduction. We've done well. We've got that low-hanging fruit. But we have now sort of baselined, I think, at that point, and need to reawaken what we do to improve that further. And I'll come on to how we envisage doing that. But within that, also, I think there's some potentially hidden data, which I mentioned just how small our HPCIA usage is. There we are, look, half of 1% of everything that we inject. And actually, we're seeing increases in the tetracyclines, the beta-lactams, and to an extent, the sulfonamides as well. And when we do that, of course, we're then talking about giving higher mg per kg dosages to animals in order to achieve the same outcome as we might have done with some of those HPCIAs. So I would actually argue that maybe that 30 odd mg per kg is hiding ongoing progress, which is being made as we evolve from those HPCIAs back towards some of the more traditional, if I can put it in those terms, antibiotic drugs. Just seen a lovely presentation on what's been going on in companion animals across in the United States, and here's where we are in the UK, that we're seeing this trend downwards in usage, but not in the same way. And I think there's different challenges, aren't there? We've talked a little bit about prophylaxis, metaphylaxis in the farm animal field. We don't have those same issues in the small animal field, but what we do have is an evidence base which is moving us away from preventative antimicrobials on an individual basis. And there I'm thinking particularly about, the dose of antibiotics that was encouraged to be given around sterile surgical procedures, for example, until as recently as a few years ago. And, we've been led by the evidence there, not just the evidence on antimicrobial resistance, but also the evidence that says doing that, you may actually see more wound contamination, more wound breakdowns than if you don't do it, as long as all else is equal and that procedure was done in an effective way. So we're trying to follow the science. We've also just set up a RUMA for small animals, and I'm going to come on to talk about RUMA now, because RUMA is a Responsible Use of Medicines in Agriculture Alliance. And it was interesting to see Nina's question in the chat earlier to say, how can vets and farmers be included in the fighting against AMR? Well, in the UK, this is our answer. So as far as I know, this is completely unique, and we've brought together farmers, vets from across the piece to across all sectors of production animal medicine to set targets and to hold ourselves accountable to those targets, and also provide some solutions as to how we're going to achieve them. I don't expect you to read through these, but just to highlight, these are the targets at the end of the cycle that we've just been through. And essentially, if they're green or yellow, we've achieved them early or on time. So the only ones that we haven't achieved are those pink ones. And there've been a few blue ones which are just the data is not available. So we're doing well, but we're not complacent, and we've moved on and we've set further targets now within the profession and within the industry. Not least that we want farm vet champions in the veterinary profession available to every farmer. So there's roughly 5,500 vets in the UK working on farm animal medicine, and we've committed that by 2024, 2,400 of them are going to be farm vet champions, trained up under the BVA as an umbrella, but through their species divisions, to understand where those wins can still be. But also, and I think equally as importantly, to understand a little bit more about the social science around behavior change and about how we're going to influence change on those farms and with those farmers to really make the difference that we're absolutely committed to making in terms of antibiotic usage in the UK. Thank you.
Oh, thank you very much, Dr. Russell, for your presentation. I think it's very inspiring to see the work going on at the UK in the fight against antimicrobial resistance and the work on food animals. I was so amazed to see the reduction from 56.8 to 31.9 within that number of years. That was very inspiring. I also agree that biosecurity is very important in the reducing disease transmission, and also ultimately also in the fight against antimicrobial resistance. Stewardship is also a very necessary thing that we all need to do in this fight, because everyone has to take responsibility. Also the One Health approach, just like other speakers have also mentioned, One Health approach. And then also, the Farm Vet Champions Initiative is also very inspiring, great work. And thank you very much for sharing this with us, Dr. Russell. Yes, so we've had all our speakers, and now we would have question and answers. We have some questions in the question and answer section. So I will just read out